Is this better? All right. This is great. This means like everyone's awake. Okay. Well, it is an honor to be here. It's been a wonderful conversation over the last day and a half. So it's really fun for me to get to do something like this. You're going to see and you're going to hear our panel is going to talk about things a little bit differently maybe than some of the earlier discussion. So that's good. We like to be provocative. I think one of the things is we've already talked about the financial economic hardship. I mean, I do this day in, day out with a lot of our clients in healthcare. It is true, the financial pressures are really substantial. And what I'm going to be sharing with you this afternoon is why we have to figure out new solutions, right? So Kevin, I love, a lot of the things that you said, quotes. I'm a big quote person. And one of my favorite people in the world has been Albert Einstein, and one of the things is we can't use the same level of thinking that created the problems to solve the problems. So that's going to be one of the things in terms of stretch thinking as we go through our panel and share. Obviously, there are many barriers to doing this work, but we also have this really big reason to do that. So I want to just get a quick poll. When you think about climate change, if someone says climate change, what iconic image pops to mind? What do you think? Nuclear reactors, great. What else? Ozone, yes. I remember working on hydrofluorocarbon inhalers and all of that when I was in hairspray when I was in high school. I've been at this for a long time. What else? Sea level rise. Glaciers, yes. Wildfires, yes. Downtown China. Tell me more about that one. Oh, yes, all of the poor air quality. Okay. Great. Well, we heard glaciers, and that is one of the things, this is often the iconic image, right? So we're talking about justifying at all expenses. You want to go to a CEO and they're going to say, that's great. That's in the Arctic. That's not, what are you trying to make me, reconfigure this, look at things in a different way? Everyone who knows me knows I'm like a total animal lover. I have chickens, I have cats, I love animals. I love polar bears. We go to see them at the zoo with my daughter. And at the same time, I think it's the wrong narrative, because ultimately what we should be thinking of is this, right? It's everyone who's in this room, it's our kids, it's our families. And when we talk about the impact and why we're going to be justifying the cost to get to net zero, this should be the image that we're thinking of, right? I think it's really powerful because it's everybody in their day-to-day lives. And it is, we're not at that point yet, but I think a lot of the conversation around climate change in particular and why we need to take action has been future focused, right? In 2050, which that is, we have a lot of the climate scenario planning things, but we know that many of these things are happening in the here and now. Right now, even just in terms of what's happening in Maui, a beloved place that I love to go, is having all of these major wildfires. So it has a direct impact now. This has really been informed by my clinical practice. So I know we've heard a lot of this over the last day and a half on the social, economic, and environmental factors. We were together last night, and I was saying one of my big passions is innovation. So I love really thinking about how do we keep people healthy. I went into pediatrics because I wanted to keep people healthy. I'd done adult medicine, internal medicine, and other things. I loved neurosurgery, but ultimately I decided to do pediatrics. What was really interesting was pretty quickly, I learned that many of the kids were struggling with chronic disease. So very high rates of asthma, very high rates of suicide, depression, that we saw already, and they're going up. Obesity, high cholesterol. So all of these chronic illnesses, and I was like, I got really curious. Why was this happening as I worked with the patients I worked with? So when I was on faculty at Stanford, I spent my clinical time at our partner federally qualified health center in East Palo Alto. So very high rates of unemployment at the time. Obviously there have been changes over the years, but it was around 18 to 20%. A lot of community violence. We'd have shootouts and go into lockdown. And when I thought about asthma, so this was a real eye-opening time of why the built environment was so important for human health. It's one of the social determinants that we often leave out. We often talk about social and economic, we forget the environmental piece. But things around whether there was a grocery store present or whether the community was walkable, if it was near a high roadway area, we knew that the risk for asthma development was much higher. And so I think that time in my clinical practice really deeply impacted how I think about this work, which was ultimately why I ended up leaving and joining the governor's office in the state of California to work on a lot of systems change and innovation. But when I did that, I think the part of the thing was that we were thinking about health, and as we looked at this data, I actually got to spend time with the National Academy of Medicine working on the Communities in Action Pathway Towards Health Equity. And basically, we looked at all the literature. It's still one of the top cited publications from the National Academy of Medicine. We looked at all the literature around social, economic, and environmental factors. And around 80 to 90% of our health ends up really being an outcome, not necessarily what happens in the OR, but what happens in your communities. We've talked about all day today, right? But I think part of that is that the built environment, each and every one of you in the seat today have a huge role to play in helping to change that, to make these numbers better when we start to think about health equity. So if we think about some of those pieces and you say, okay, well then where does climate change come into that? You know, we're talking about net zero and justifying the cost. This is from some work that a paper we published on climate and healthcare from Deloitte. And so, you know, as we think about obviously race and equity and power structures, all of those are such core pieces to the outcomes. But when we think, we get kind of granular, right, and start to think about these different social, economic, and environmental factors. So in environment, you have physical environment. We know, you know, lead, there's just been a lot of things around toxins, lots of products in our built environment that can have an impact directly. Food is part of the environmental piece, and as well as infrastructure. But when we think about climate change, I actually think it's a force multiplier across all of these, right? So we know that these social, environmental, and economic issues are having a direct impact, but they have a force multiplying impact. So just as an example with food, as we see things with climate change start to, you know, decrease crops, Georgia, I don't know if anyone's from Georgia, I heard ran out of peaches this season, right? Because of all of the climate and environmental things happening. I live in California. I know a lot of our growers that we work with have had major impacts to their crops. And so when you think about that, the cost of food is going to rise when we already have a lot of people who are food insecure. You think about some of the big storms, right? So all of those things can, you know, disrupt community connectivity, have an impact on jobs, have an impact on homes. And so this is why we think about it as a force multiplier. Don't worry, we're gonna get to solutions, so don't be depressed. I see some really sad looking faces, but we are all about getting to change. One thing I did want to mention, I know this came up in terms of like, well, what about the science? So some people, and I've had a couple of conversations, some people say, well, maybe we just consider healthcare a hard to abate sector. We say margins are low, it's really complicated, we know we have a high energy usage, let the other sectors do it to solve this. I'll say, well, there's a yes but on that. The other piece is just if you said, well, what if global warming weren't being caused by humans? I'd say there's a 98% consensus with scientists, and I love data, and so when you track the data, you can see this in terms of the concentration of particulate of CO2 and post-industrial, and it tracks to the forecast. So this is another great report. It's all publicly available. So I would say, even if we don't think about the human implications, we know that from an adaptation and resilience perspective for health systems in terms of the infrastructure and the impact to health, we'll have to do more. And when we look at, this came up yesterday in the panel, so how much does healthcare contribute? It actually is a fair amount. I mean, in the US, it's between 8.5 to 10% of the contributions, so pretty substantial component of that. And a lot of this is because, we have a high standard of care, high energy demand, a lot of waste generation, and really complex supply chains. This is from work we did actually with the Commonwealth Fund and the Black Directors Health Equity Agenda, also available publicly, so lots of great information in there. And this came up again as well on where the scopes, right? So when we're thinking about where the sources are for these emissions in the high usage within the healthcare systems, it's really from, in terms of scope one, it's like what's happening on site, and our panel is going to get into this as well. Obviously emissions, it's a vehicle owned fleet, there are all these different things, like if it's not vehicle owned, it's leased, it goes somewhere else, but generally this is the case. Obviously anesthetic gases is a big part of that. And then scope two from indirect of generated of purchased energy, and then I feel like scope three is just kind of everything else, which is when you look across these, that's why scope three is about 70 to 80%. It depends, some places it's even 90%. It depends on your own numbers, but generally it's around a 20 to 30 for the first two categories. All right, so as we pivot to what about with health impacts? So as we think about all of these impacts from climate change, and we call them impactors, things like the wildfire, rising sea level, the extreme heat, severe weather events, all of these different components, they also have a direct impact on human health. Now, we, if you look across this, some of the, and I would say for sure health equity, just as I mentioned, it's a force multiplier. So we've looked at this, and so the communities that are most at risk already for these poor health outcomes are going to be even at greater risk from these climate events. We have some of the numbers here about increased migration by 2050, but I would say we're actually actively looking at those numbers and the impact to health now. Just to give a sense, we've seen the media start to cover this in a different way, so I think the narrative is starting to change from polar bears, although I still see things with polar bears. But we are starting to see, hospitals seeing the noticing of the increased demand on utilization in emergency rooms. And that's why I start to say, like, whether we want to think about it or not, we are not going to, it's one of those things, I remember when I was practicing, we had a lot of uninsured population. It was a big thing. We'd have people come through, they'd get this very high workup in the emergency department, and then they'd go back to the streets because they were homeless. And I was like, why can't we get them from being admitted? But so we're starting to see the numbers be public. And I won't read all of these numbers, but this is just, I think as we're seeing climate change exacerbate these health inequities and the cost, we're seeing it become more part of the dialogue and conversation, which is, I think, changes the imperative to act. I don't have it up here. We've actually done some actuarial claims analysis. We have these amazing actuarial teams that I work with. And so we've looked at the impact for actuarial analysis, and we see the increased use of emergency room, hospitalization, cost of care from asthma and heat. We actually have an AI prototype that we can do that to do forecasted care, look at the social vulnerability factors, ICD-10s, et cetera, in the hopes of actually doing preventive care and getting to those patients sooner. But just as one example, in the heat wave in Wisconsin leading to 24 deaths, 1,600 ER visits, and 150 admissions, that to me is really material impact in terms of operations. So I said I promised that I wasn't going to leave everyone depressed, but I still see some sad faces. I'm an eternal optimist, so I will go down until the day I leave this planet working to make it better. One of the things I work with, and we've been having this conversation, so anyone who's going to be at Climate Week in New York, let me know, would love to invite you. We've been brainstorming on ways with Jake Barton. He's an amazing designer. He is based in New York. He actually designed the 9/11 Museum. And this is an experience to bring people through, powered by the immersive experience of seeing our future and recognizing that we still have time. So all of the levers we can pull, we'll talk about many of those levers in our panel today, are there for us to think about how we change the future, because it's still there to be written. And so with this what we're going to do with this experiment, or thought experiment, kind of immersive experience, is bring people through to see what the future looks like, and it's linked to En-ROADS, which is I don't know, have any of you seen En-ROADS? Okay, great. En-ROADS is a science-based tool. It's out there. It's publicly available. You can just Google En-ROADS, and it'll come up, and it actually shows you the forecasted rise. So this is a great tool. It's you can say, if I'm going to do electrification, here's the impact on overall climate temperature over time. And so you've got all these different levers or levers that you can pull on. So we're actually building that into this experiment. So if you think about New York, which is where Climate Week is held, you'll get to see the streets flooded. And this, one of the things talking with him, he's like, this is like many of the hurricanes that have come through. So it's not far-fetched, right? Like, this isn't like bad science or to integrate fear. We actually don't want fear. We want people to feel empowered on the changes they can make. But as you start to do some of these levers, whether you're a hospital system or a school district or a retail, big tech company, as you pull those different options, these are the things that you start to see change. And as you get to a lower and lower degree, you start to see that there is a potential for a healthy future. So, I think as we head into the conversation, I like to think about it in terms of mitigation when we think about health systems. Mitigation, meaning do less of the emissions. Adaptation resilience, meaning like whatever happens, whether you're mitigating or not, you're still going to be faced with these things around mitigation and resilience, because high heat is, in California, for instance, again, it's kind of, we get a little apocalyptic there, but we have had rolling power outages from the grid being too demanded from the high heat days. We've had a number of days where like I can't go swim because the water's too hot in the pool. Like, it's become part of the normal every day. So adaptation resilience. And then I think the last piece is transformation, which we've talked a little bit about today. I don't think we can just mitigate our way out of these high emissions. You know, we're going to have to think of new ways and things to solve problems, which I think our panel will start to talk to as well. So in closing, you know, I think we have, our panel is going to be talking about net zero, but I also think that, you know, if we really do stretch thinking, you know, obviously we've got these financial pressures ahead of us, but it's come up a little bit in terms of workforce well-being, employee engagement. What if we actually started to create centers that weren't just about healing human health, but were also about healing the environment at the same time? So I do think we can get there. It's not going to be easy, but on that, I will say thank you.